Welcome to this special lecture by Professor Raghuram. As you know, the Wellness Center over the last few months were conducting several such panel discussions and lectures. And also the empaths, the student group of the Wellness Center was also conducting several programs for the campus community, for the well-being of the campus community. And I just wanted to announce that, in the last meeting, we said that we will have a psychiatric social worker in the campus. I'm happy to inform that one psychiatric social worker has joined and she is staying in the new girls hostel. And one more person is expected to arrive by the last week of November. So that apart from Mr. Sridhar and Ms. Savita, who are the campus counselors, we will have two psychiatric social workers as well in the campus. And I mentioned in the last meeting that we have identified 8 doctors who will be in our panel, and soon the announcement you will see in the website of Wellness Center. And then those who are interested in meeting a psychiatrist or a counselor can go through the website and then find out the contact details and approach them directly without referrals. So those details we will be putting in the website very soon. So today I would like to welcome Professor Raghuram, who has kindly agreed to give this lecture, and this was the initiative by Professor Bide. Dr. Bide was helping us all along with the Wellness Center, and so Professor Raghuram was Professor of Psychiatry for more than 3 decades at NIMHANS. And after that, he was invited by United Arab Emirates government to set up a postgraduate residency program. And he has successfully done that, and he has now returned back, and then now he is heading the psychiatry at the Kempegowda Medical College. And we are very happy that Professor Raghuram is with us. And may I now invite Professor Raghuram to deliver this special lecture.
Thank you so much. Thank you so much for your kind introduction. Let me set the ball rolling by stating that, as you're all aware, these are all very, very unsettling times. The uncertainty that entails as a consequence of this leaves its footprints in our emotions and on our behavior. Sometimes artists have a way of narrating the impact of these very eloquently, like this song from Aerosmith. This song really states there are moments in our lives when reality presses us with such intensity and we experience the pain of living in the sharp edge of uncertainty. Like many other music groups, Aerosmith also had their trysts with psychological issues. But in spite of that, they kept their creativity flowing. And many of you might be followers of Aerosmith too. As I mentioned earlier, artists have a way of portraying, narrating the emotional impact of various issues in their personal life. So living on the edge of uncertainty is not a very easy task. When you are in that position, often you feel burdened by that, and it dampens your spirit, and you start feeling a little sad. A state sometimes known as feeling blue. As I mentioned earlier, artists have a way of portraying these states. One of the important moments in the history of painting was when Picasso the slides are not moving, so
yeah, you could so you have logged in through the, uploaded the thing through the desktop sharing, right?
Right, that's right.
Okay. can you just come out once and then log in back? Because last time it worked, so we can try once again.
How
We can
do I
unshare it.
unshare it?
Yeah, it has moved. It has moved. Okay.
Now, it's okay?
Yeah,
Yeah,
okay. Yeah. So can you just try once again whether you are able to go to the next slide?
I'll try the previous one. Yeah,
Yeah. Okay.
yeah.
Then it's fine. Yeah.
Right. As I mentioned, Picasso's blue period gives a very perceptive impression of the states of blue. Picasso in 1901 started painting his canvases in predominant hues of blue, which is also known as the blue period. Why did he do that? It all started when Picasso was just 19. The death of his dear friend, poet Casagemas, affected him deeply. And it served as a catalyst for a series of canvases characterized by hues of blues, conveying pain and desolation. But Picasso is not alone in despair. We have all felt our own blue periods. It's part of the human condition. The same darkness that lurks in the shadows of Picasso's palette can creep into our lives. And when it creeps into our lives, we go through a period of sadness and depression. So, what I will strive to do in the next couple of minutes is to unravel and understand depression. In doing so, what I intend to do is trying to focus on as to why we have to focus attention on depression, how depression manifests, and how well it can be handled. Depression is simply a global crisis. If you look at the map of the world, it depicts the worldwide levels of disability due to depression, with darker colors indicating a higher level of disability due to depression. And you will notice that India figures very prominently in the higher levels of depression and associated disability. The prevalence of depression in Indian population is estimated to be around 4.5%. Around 54 million people are affected with one kind of depression or the other. What is more important is 1 in 20 people report having an episode of depression in the previous year. 1 out of 10 people suffer from major depression. 1 out of 5 person has suffered from depression during his or her lifetime. And it is among the second leading causes of disability across the world. And by 2030, it is expected to be the largest contributor to disease burden. So it is imperative and important that we start paying attention to this ailment so that we can address the suffering associated with that and strive to reduce the disability which arises as a consequence. The burden of depression, moreover, is 50% higher in women compared to men. And a very unsettling epidemiological observation of late is that depression has increasing occurrence at a young age and causes considerable dysfunction and impacts the functioning in a major way. It is said that an average person suffers from common cold for at least 24,000 hours in his lifetime. And we could easily call depression as the common cold of psychiatry. What we must also realize is that there are varying shades of blue. Depression is not a very homogeneous entity. It varies in severity from being mild to moderate and severe intensity. Mild and moderate depression is far more common than severe depression. And severe depression, when it occurs with only episodes of depression, it's called as unipolar depression. And when it alternates with mania, it is called as bipolar disorder. Now let us look at domains of expression of depression. There are 5 important domains of expression of depression relating to the way you feel, the mood, the cognition, vegetative symptoms, psychomotor expressions, and physical symptoms. What is important to recognize about the presentation of depression, especially when it is mild to moderate, is that the vegetative, psychomotor, and physical symptoms are often the first presenting symptoms. For example, tiredness and easy fatigability are by far the most common presenting features of depression, especially in mild to moderate degrees of depression. People who experience tiredness often express it in these words. It seemed to take the most colossal effort to do the simplest of things. I found everything excruciatingly difficult, and even if I forced myself to do it, I felt totally drained of energy and just wanted to get back to bed. So this draining of energy and easy fatigability is the harbinger of depression. Depression is also associated with physical symptoms. As William Styron, who wrote a very perceptive account of his own tryst with depression, mentioned in his book, the grey drizzle of horror induced by depression takes on the quality of physical pain. So fatigue, tiredness, and physical pain are the harbingers. And this is closely followed by changes in the sleep rhythm, difficulty in falling asleep or getting up early in the morning. Most importantly, whatever be the duration of sleep, the person when he wakes up in the morning doesn't feel fresh. And moreover, even when he or she is sleeping, he is constantly preoccupied about what is troubling him, what is worrying him, and that plays an important role in unsettling the sleep rhythm. The change in food habits is another early manifestation of depression. People can experience reduced appetite, aversion for food, yet at the same time, some people might also binge. And people who binge always use food items that are high in carbohydrate content. You might wonder as to why people with depression are initially presenting with physical symptoms like tiredness, fatigability, or pain. Why is that they initially do not identify and report sadness to their doctors? It is sometimes referred to as the gateway phenomenon. It is much easier for a person to present himself or herself to the doctor with a physical symptom, which is often known as, I would call it as a somatic passport to get into the medical system, because to a large extent, medical professionals and doctors are far more comfortable listening to physical distress than emotional distress. The second set of symptoms is what I would refer to as brain fog. These are the cognitive effects of depression. This would involve unable to attend to tasks because of concentration difficulties, slowing of information processing, taking a long time to execute tasks, forgetting things easily, and impaired recollection. So when the cognitive symptoms surface, it starts impacting the work situation. And the cognitive symptoms, like inability to attend and concentrate, can draw the attention of people working along with the person or the supervisors, and it might lead to some amount of discomfort in the work situation. And of course, people with depression experience sadness. More than sadness, it is also inability to experience pleasure as the veil of happiness slips away. Some also report blunting of emotion and a sort of feeling empty within. But basically, it is a kind of sadness that doesn't lift. When each one of us experience sadness, we evolve methods of working through that. It could be talking to somebody, diverting our attention, finding something far more engaging and meaningful so that the depression or the sadness fades away to the background. But none of this helps when a person is going through a phase of depression. The sadness persists. Once the sadness persists, it also influences the way a person is, his thought processes. And the person is enmeshed in a whole lot of negative views. This is also known as the cognitive triad of depression. The negative views can be about self. I am no good in anything which I do, or about the future, that things will never improve in my life. My suffering will continue like this. Or about others and the world at large. Nobody cares about me. Nobody cares about me, and nobody cares in this world anymore. So there is a cascading consequences of depression as a result of these kinds of presentation of depression. There is a social isolation that occurs because a person who is depressed feels enmeshed in his own feelings and avoids social contact, which leads on to loneliness. And if he or she is in marriage, it could cause issues in relationship, which can lead on to divorce and separation. There is also increased mortality associated with depression, simply because the occurrence of depression and medical illnesses have a very close relationship, especially in the elderly. But basically, depression contributes to poor physical health because the person doesn't attend to his or her own needs. As I mentioned earlier, because of reduced appetite, their intake of food can come down. Because of sleep disturbance, their functioning might get affected. So poor physical health is often the consequence of states of depression. As a consequence, there is increased use of healthcare facilities, and occasionally depression can be chronic. And whenever it isn't chronic, it occurs in the context of various kinds of crisis-laden life situation. And lastly, depression contributes to poor quality of life, both in personal and professional domains, leading on to decreased productivity. And all this contributes to increasing disability associated with depression, which I mentioned in the earlier part of my presentation. In spite of all this, depression often goes totally undetected. Why does it happen? Why does depression goes undetected? If a person has fever, he or she doesn't hesitate to go and meet a doctor and seek help. But what happens when he or she is experiencing sadness and depression? Why are people with depression reluctant to share their problem? It could be due to many factors. We hide it. We hide our personal distress. We deny it because we are ashamed of it, and we don't discuss it with others. This is basically because of discomfort about disclosure of emotional states, especially that of sadness and depression, because of the perceived stigma associated with that. What will happen if others come to know about my psychological distress? What will be the consequences of this revelation? Will it lead on to some kind of issues in my relationship? Will people start avoiding me? Will people in my workplace, once they notice that I am going through depression, will their attitude about me will change in negative fashions? So this perceived stigma is something that influences the disclosure of emotional distress, especially that of depression. The other associated issue about discomfort is reluctant with medicalization. In the sense, people still do not identify depression as a medical problem, but like to frame it as a problem in living. Till depression takes hold of the person and causes significant amount of disruption in his or her function. Why is there this reluctance with medicalization? This could be in relation to notions of psychiatric illness. Unfortunately, the public perception about depression is anchored in certain notions about psychiatry and psychiatric illnesses and also psychiatrists. The notions of psychiatric illness are anchored in severe psychiatric problems like schizophrenia or bipolar illness, whereas majority of psychiatric illnesses are minor psychiatric illnesses which constitute more than 2/3 of psychiatric problems. So the popular depictions of psychiatric problems in the media, in the cinema, and literature also builds up also contributes to the perceived stigma associated with disclosing about the emotional state. As I mentioned, there are concerns about the consequences of revealing your emotional state. And lastly, fears about medication. So if I meet a psychiatrist or a doctor, the moment I say that I'm feeling depressed, they might give me pills, and those pills can be addictive. Those pills can interfere with my concentration, with my life, and it can also impact me, my health. The common perception is that antidepressant cause dependence. Majority of antidepressants are used for a short period of time, and even when they have to be used for a long period of time, there are ways in which a person can be slowly eased off from the medication so that the dependence on this medication is not a major issue. So all these 6 factors play a huge role and interfere with the process of help seeking of a person with depression. So how do we address the distress behind the disguise? You would have noticed that people keep a smiling face. People keep a smiling face even when they are feeling very sad and uneasy and uncomfortable within. That is the social self. Very often we pay attention to the social self, the social appearance of a person. He's smiling and happy, so he must be happy within. It may not be so. As I mentioned earlier, a person with depression, because of issues that concern with disclosure, might maintain a very happy appearance so that people do not notice what is happening behind that disguise. Let us quickly review as to what makes a person susceptible for depression. This is what I would refer to as a threshold model because it encompasses certain long-term factors, short-term factors, and immediate factors. long-term factors like which predispose a person to experience depression. Short-term factors are risk factors which predispose a person, and immediate factors are stress factors which are both emotional as well as physical. The long-term factors, the most crucial component is the family history. Family history of suicide, both attempted and completed. Family history of severe mood disorder. Presence of alcoholism in any member of the family. In terms of personality traits, poor problem-solving skills and an overwhelming attitude and disposition towards pessimism and low self-esteem could be a long-term factor which predisposes a person to experience depression. Short-term factors are environmental factors, in which a person can be, if he's married, divorced, separated, or widowed, older or unemployed, poor social support, or presence of psychiatric illnesses like substance abuse or personality disorders. Precipitating factors are all in the realm of crisis situations and stress, like bereavement, loss, stressful life events, relationship problems. And all this contribute to have a cascading effect in terms of resulting in depression. In addition, in the last couple of months, the impact of social isolation also plays an important role in terms of influencing the mood state of persons. Social isolation contributes to loneliness, some amount of boredom, sense of emptiness, and lack of social connectedness, which can worsen depression, can also contribute to depression. Basically, life is a balancing act, and depression is a kind of a balance that we strive to maintain between the various kinds of stressful events that we are experiencing in our life and our methods of coping with it. There is also a close relationship between depression and a sense of despondency. When I refer to the sense of despondency, it is about the occurrence of suicidal ideation, suicidal thoughts, and attempts. So it is extremely important to address the suicidal behavior which occurs in the context of depression. And hopelessness is a very serious warning sign that indicates that a person is prone to engage in a suicidal behavior. When a person is going through a suicidal thought of feeling hopeless and helpless, there is an important role of what I would call as gatekeepers. Doctors who are able to recognize the state of hopelessness, teachers who are able to identify, close friends who are able to notice, and most importantly, supervisors and colleagues at work who pay attention to the state of hopelessness that is occurring in an individual person. What are the red flags? We have to look for any of the following: history of depression in the past, multiple unexplained physical symptoms, recent major stress or loss, higher healthcare utilization, chronic pain without identifiable medical cause, complaints of sleep loss and fatigue, and suicidal ideation. If any person is going through any one of this or a combination of this, I would ask that person to reach out. Reach out for help. And especially if there is ideation about self-harm, kindly reach out to suicide helplines. There are a couple of suicide helplines which is already operating in the city, because helpline is always a lifeline. So let's move on from awareness about depression in terms of how it presents itself, what could be the contributing factors for a person to experience or go through depression to actual management. Whenever we talk about management of depression, we talk about medication. And there is a whole lot of medication that is available to handle the depressive state. What we have to keep in mind that all the antidepressants are equally effective in reducing distress, and they are fairly well tolerated. Unfortunately, there is a lag period to onset of action, which ranges from about a week or to 2 weeks. As I mentioned, all antidepressants are all of equal efficacy, but there can be individual idiosyncratic response as to which kind of antidepressant a person responds. Majority of patients will not require long-term use, especially and those who suffer from, as I mentioned, unipolar depression or bipolar are persons who will require long-term medication, mainly as a prophylactic measure to prevent occurrence of relapse. And antidepressants can be weaned away with much of ease, so there need not be too much of fears about dependence attendant to it. And as I said, there are a plethora of antidepressants. I will not go in describing each one of them, but keep in mind that when antidepressants are needed, when the doctor feels the need to prescribe the antidepressant, that decision is based on the symptom severity, the kind of impact that it has on the vegetative functioning, especially sleep and appetite, and how it impacts the thought process, especially in terms of feelings of helplessness and hopelessness. So when a clinician is able to assess the state of depression and feels the necessity to start an antidepressant, kindly, without much hesitation, start taking it, because they play a very important role in terms of mitigating the suffering that a person is experiencing. That said, we must also recognize that there are therapies which can be used in addition and beyond antidepressants. And among the therapies, the most important therapy is the cognitive behavior therapy. The cognitive behavior therapy emphasizes as to how individuals react and respond to events in terms of their perceived significance, which is influenced by beliefs, attitudes, and expectations. And the cognitive behavior therapy focuses on identifying, monitoring, and working through negative thought processes so that the person doesn't feel burdened with that and finds an effective way of handling his distress on his own through a process of cognitive behavioral intervention. Let me give two examples of the cognitive beliefs and distortion that can occur. Firstly, there is always an overwhelming need for affirmation in all of us. Need for affirmation from outside. Everyone has to like me. My worth depends on how others see me. What other people think about me is really more important than anything else. The problem is, the trouble with this belief is that it puts our happiness in the hands of others. We really cannot control how others react, think, or how they judge us. The second one that contributes to these negative cognitions are the need to be perfect. If I fail at my work, I'm a failure as a person. If I don't understand completely, it means I'm stupid. If I can't keep up with everyone else, I'm inferior. If I make a mistake, it is as bad as failing completely. If I'm not perfect, I'm a failure. So self-worth is coupled to performance in various roles. And the need to be perfect is also related to a state of discomfort about recognizing that all of us can be imperfect in one way or the other. The second therapy that is of equal importance and effect is the interpersonal therapy. The interpersonal therapy focuses on addressing and resolving interpersonal conflicts linked to the onset and maintenance of depression, which is often in close relationship. It could be strained relationships at home with the parents, strained relationship between couples, strained relationship at work. So when depression involves and occurs on the background of these interpersonal contexts, this particular therapy is of much value. What we must realize is that therapies help. How do they help? They help to accept the loss of self that occurred during a breakdown. Whenever there is a breakdown, we feel that it is something which is alien to us. But therapies help to encourage a person to make sense of the new self that he or she has attained through a therapeutic process and discover the strength within to cope up with adversities in life. What we must remember finally is that depression is neither anchored in our chemistry, and of course there are a lot of insights as to the neurochemical, neurotransmitter basis for our depressed emotions. So it is neither purely anchored in our chemistry, not purely enmeshed in our circumstances, but in our will to work through choices available to us in our everyday life, using our own innate resources to discover new meanings and new purpose in life. I started off this presentation drawing attention to Picasso's blue period. That blue period just lasted for 3 years. And after that, Picasso went into the rose or the pink period, and that brought color into his life again. And it can happen in each one of us who undergoes depression. No matter what you're going through, there is always light at the end of the tunnel. It may seem hard to get to it sometime, but people with depression can do it. Just keep working towards it. Thank you.
Yeah, thank you. Thank you, Professor Raghuram. So I think we shall start with a question and answer session. So what I shall try to do first is we have some questions that we have received through our questionnaire. So I will read those questions, and in the meantime, when people want to ask questions from the audience, they can also raise their hand so that they can ask the questions directly. So let me just go to the questions. So these questions are framed prior to your presentation. So many of them are being answered, but still to re-emphasize the fact that probably I will ask these questions once again. The first question is that I always feel unwanted. Because of a series of events, I have now become someone I'm not familiar with. I lost the enthusiasm I had. Is it a phase or what?
Yeah, it could be a phase. It could be a phase, but as I mentioned earlier, it could also be a harbinger of depression. The moment you notice that these two states linger on for a longer period of time, and it starts impacting your functioning in all walks of life, there is a need for you to seek out help.
Okay. The second question is that what are the ways in which to deal with an existential crisis?
That's an interesting question because all of us go through existential crisis. And to me personally, existential crisis is an inevitable part of life. It is not something that you can avoid. Existential crisis can also empower us. And, I'm suddenly reminded of Elon Musk. Recently, he gave a interview to a person who asked him as to whether he had gone through an existential crisis. And he said, of course, like all youngsters, I went through an existential crisis. And what helped me was a novel. Any idea what the novel could be? Hitchhiker's Guide to Galaxy. So Elon Musk, what I'm trying to say is that when you go through an existential crisis, you discover a new meaning and purpose in life. It could happen by reading something. It could happen by an enriching experience, by a relationship that unfolds and gives you a new purpose. But whenever you are in existential crisis, the question that crops up is, what is the purpose of life? And there is a small adage saying the purpose of life is a life full of purpose. And the life full of purpose is defined by the person without feeling overwhelmed by the crisis to find a new meaning and purpose in life.
Okay, so probably I'll take one question which has come to our chat box after listening to your lecture. So, can cognitive symptoms start without physical symptoms? How long should these symptoms persist that should make one alarmed? Should one be concerned if such cognitive symptoms starts in isolated episodes following stressful situations thrown in by life and gradually die down in a week or two?
See, cognitive symptoms by itself can be the presenting features of depression. If it just lasts for a week, if it doesn't impair a person's performance and role functioning in various aspects of life, there is no need to seek help. But as I indicated earlier, all these symptoms, the benchmark is the impact on the everyday functioning, whether it is in terms of personal relationship or professional performance. So to reemphasize, cognitive symptoms can occur in the early phases before a person starts noticing that he or she is feeling intensely sad or depressed.
Yeah, so then let me take another question from the questionnaire. Is there any role of moral philosophy in psychiatry? Homosexuality was not too long ago considered a mental illness. What changed?
The simple answer is the landscape is not stagnant, it keeps on changing. And our perceptions about what constitutes an illness keeps in pace with the changing landscape. Homosexuality, which is viewed as a crime, which was later on viewed as a disorder, as you understand now, is no more, because the perceptions of sexual preferences has changed in terms of keeping with the larger context in which such behavior is occurring, the socio-cultural acceptance of that too.
Okay, so I'll take one question from the chat box. Anxiety attacks before doing anything new, either to move new places or work pressure discussions. How we should deal with? Sometimes it causes physical pain.
Yeah. See, this is what is anticipatory anxiety. Before you do a task, you keep wondering and you keep worrying. And that can translate easily into performance anxiety. The way to handle it is, firstly, acknowledge that this is occurring in your life. And secondly, once you acknowledge that you are experiencing anticipatory anxiety, which interferes with your performance, find out methods by which the levels of anxiety can be dampened. And that levels of anxiety can be brought down by simple measures these days, like practice of yoga. Various kinds of breathing techniques can help a person to relax There's also other methods by which a person can achieve states of relaxation. And the choice of achieving states of relaxation is highly idiosyncratic, in the sense that for some persons it could be yoga, some persons could just listen to music and feel a state of relaxation. So a person with anxiety has to start experimenting as to what can bring down that level of anxiety by measures taken by himself. And if that doesn't help, it's always prudent to seek help from a counselor who can teach you some relaxation techniques, which are extremely effective to reduce the heightened anxiety states.
Thank you. The next question. I have been waking up with my heart beating fast and staying that way through the day for the last 2 months. I have also been having an upset stomach every day, something that I usually have only before an exam or a deadline. What is happening in my body and how do I resolve it?
What is happening is you have persistent symptoms of anxiety, which is manifesting itself through physical symptoms. And one of the common ways in which anxiety expresses itself is through the gastrointestinal system. So if it has lasted for 2 months and it is interfering with your functioning, it is highly important that you take care, meet the counselor. As I mentioned earlier, the counselor can teach you very effective self strategies to dampen the higher levels of anxiety. Kindly do not neglect it.
Yeah, the next question is something that you have already dealt in this lecture, but still I will ask so that that becomes kind of a summary as well. How do we know that I am in stress? Maybe mild. I don't know what is stress and how to find out.
Yeah, if a person himself, he or she will know what is stress. Stress is an altered state of being, in which you find that you are experiencing higher levels of anxiety. The way stress manifests is higher levels of anxiety. And higher levels of anxiety can translate into performance, role functioning, and any other kinds of involvement at work. Moment you identify that your level of anxiety is impacting all these areas, all these domains of your functioning, recognize, and as I said, stress levels to be brought down, it is not necessary that you should take medication to begin with. There are various methods by which the levels of stress can be brought down by counseling, by behavioral strategies. And what is important is if you're prone to experience stress, it is extremely important for you to learn strategies by which you learn to handle your stress so that it helps you, not in a particular circumstance in relation to your work, also as a strategy in life. Because stress is an integral part of our existence and it's not going to go away. So if a person experiences higher levels of stress in every walks of life, it is important for the person to learn skills of handling that stress, which will help him over a period of time to handle other kinds of stressful situations. At this stage, it may be in relation to studies, later on at work, much later on in relationship. So stress is going to be a part of our life. It is important for us to evolve strategies of self-help through guidance and support from outside.
Okay. It's an interesting question. A century ago, people didn't know what is depression. Why suddenly it has become such a grave problem? Same goes for other mental problems.
It was not labeled as depression. Distressed emotional states have always been recognized all through history. But the frames of reference and understanding have changed over history. At an earlier point in history, the change in mental status emotional states will be viewed in relation to supernatural causes, which really changed over a period of time with the age of enlightenment. And enlightenment also suggested that changed mood states could be a function of physical causes. For example, Hippocrates also suggested, even at that period in time, much before enlightenment, period of enlightenment, that melancholic states can be due to various kinds of humoral disturbances within the body. So that there are emotional states that are distressing have been recognized all through history. The frames of reference of understanding have changed. In the past couple of decades, we have framed it as depression. Depression so that people with these kind of states can get formal help instead of attributing it to an emotion, supernatural cause. They can easily take help so that it can get ameliorated through medical intervention. So it is not that depression has not existed all through history. Distressed states of mind have occurred in human beings all through history. The framing of it as depression as a medical disorder is a function of the changes in our understanding and how well it can be handled.
Thank you. Next is a slightly lengthy question where the student is trying to explain. I'm currently working from home and writing my thesis. However, since I am in my 7th year of my PhD with no scholarship at this point of time for almost a year, I'm getting criticized from my father regularly, whether passively or actively. The truth is, I am dependent on him for accommodation and food, and though I have done some money saved, I believe not to return to IISc till I submit my thesis due to the higher risk of COVID-19 infection there. My father has an anxiety disorder issue. Moreover, he is very stubborn with a perfectionist attitude and refuses to trust anyone but himself. I have given up I've given up communicating with him. Although his words dangerously lowered my self-esteem in my childhood, it does not affect me that much now. But I must admit, sometimes these words really push me towards mild depression sometimes, making making me unproductive for days. Should I endure this till I get a postdoc? Or if so, how can I protect myself? In his view, my career of choice is worthless, which I know is wrong, but sometimes his words get me. Please advise.
It's a very unstable situation. And as mentioned earlier, this distress states of emotion can occur in an interpersonal context. In this instance, it is with a father who is perfectionist, making a lot of demands, and more importantly, not very supportive to his own son, who is taking some time to finish his thesis and making a lot of pressures on him so that he can finish and start earning. For him, PhD for 7 years has been unproductive because he has not been an earning member of the family. So there could be some issues in terms of the father could be at a phase in his life in which he is looking forward to retirement and settling and pining a lot of hopes on the son to finish studies and start earning. And the son is facing the burden of expectations from the father. In such situations, what this person has to do is recognize that this is in relation to a particular interpersonal context, in relation to, for example, with his father. Now, even after he finishes his PhD, if he starts working, the father can be replaced by a manager who is also a perfectionist and exerting a lot of pressure on him to perform at his best. So these kind of situations are not going to go away from his life. At this moment, he may say, it is my father who is causing this, but later on, he'll experience the same with a very perfectionistic, demanding supervisor or a manager. So my suggestion is, instead of just focusing it purely in relationship with his father, if he's identifying it as something that is interfering with his functioning, he has to evolve methods of coping with it. Methods of coping with an ununderstanding, demanding elderly person. And those kind of coping styles can be evolved, experimented with counseling. he can meet a counselor and try and find out as to how effectively he can handle this so that those coping styles come in handy even after he finishes the studies and starts working.
Thank you. There's another question which says, I feel all alone, especially when I am in group of people in the workplace. I would like to discuss many things about work, learn from them, know about their work, etc. But I won't be able to do so. It's not that I'm completely an introvert. I am expressive in certain places and with certain groups of people. I blame myself for all this, and at times it gets really hard to cope up with my own self. Can you suggest something about this?
See, firstly, start feeling comfortable the way you are, right? If you are a person who's as of the silent kind, right? And then you start feeling uneasy in expressing yourself in social situations, start acknowledging that that is the way you are. Secondly, you have to improve if you want to communicate to others about certain kinds of issues. You must try and experiment as to how well you can communicate.
Yeah.
The problems in relating or communication can be face to face, right? In social situations. In such instances, you can also, this is also called as social anxiety, which is not a disorder. It is something that some of the persons experience in terms of handling interpersonal relationship in a social context. Again, social anxiety can be handled effectively through counseling. More importantly, communication is not really confined only to face-to-face interactions. So if a person says, look, I have to communicate my feelings, my thoughts to others, he can always find other methods of communication which come in very handy these days. So let him not bottle up, say, feeling that I cannot, I have communication and rest content with that. Recognize that it's a social anxiety, take some help and counseling, start communicating in some ways, even without involving face to face encounters. And lastly, this should not translate into a negative evaluation of oneself. As I mentioned at the earliest, accept the way you are and work on it. All our life is experimentation and an evolution. We are not complete human beings, right? So, moment we acknowledge that these are the issues that I have to handle in my life, handle it with a lot of self-affirmation that you will be able to do it, and that's the way forward.
Thank you, Doctor. Uh, I tend to assume a lot about what people think about me or about a conversation or an incident happened. I always fill with negative thoughts, and at times I get them even in dreams. It is really disturbing.
Yeah, this is what alluded to in one of the slides which I explained,
Yes.
which contributes to a negative perception about yourself and then also a negative perception about others, right? So again, this kind of modalities of thinking and perceiving others, you recognize it, that this is hampering. This is the way I relate to others. Is there a way of changing that, modulating, experimenting with that? And that can happen with counseling. And these days, counseling need not be face to face. Also, if a person has these kind of issues, you can also go to the internet and find out. There are a lot of people who might face similar situations, get some suggestions, and then work on it.
So again, there's a question. What is the difference between depression and being sad? How do you know a person is in depression?
Yeah, as I mentioned earlier, all of us go through periods of sadness. Sadness translates into depression when number one, it lasts for a longer period of time. Secondly, the intensity keeps varying from mild, moderate to severe. And thirdly, as the intensity increases, it starts interfering with various domains of functioning, which I have listed, cognitive, vegetative symptoms. Notice that and then recognize that it is not just sadness, it is depression, and take help.
Yeah, so this is a slightly lengthy question. I have experienced a depressive episode with an anxiety disorder. Though my functionality improved in area of academic work, I still have ups and downs. I am still under treatment, medication. I may not be pronouncing it correctly. Escitalopram, yes, and under therapy. Earlier, I used to take clonazepam also. I have periods where I am highly productive and happy, as well as periods where I am completely down to self-harm, suicidal thoughts, and panic attacks. What is your thoughts on how someone with fluctuating and unpredictable moods as mine can affect academic work?
Yeah, fluctuating intensity of emotions is not a very unusual feature in depression. Depression is not static. Even with treatment, there are moments in which the intensity of depression can increase. And during those moments, a person can experience doubts about himself, helplessness, and suicidal ideas. And these cases, the person should recognize that all these are symptoms of depression. There is a different way of configuring the situation. Instead of saying that I am feeling depressed, a person can articulate it saying that I have depression. When I say I am feeling depressed, there is a certain degree of identification with himself, which translates into a situation in which he feels helpless to handle it. And he feels help has to come from outside. If he starts identifying it, saying that I am going through depression, I have depression, then he identifies it as a disorder. Then he identifies it and acknowledges that he can take help to address all the negative cognition that he is experiencing and take help for the suicidal ideation. A change in framework of conceptualizing depression itself can be very helpful.
Okay, thank you. A contemporary question. How do you cope up with online learning which has high stress levels in life?
Yeah, see, online learning, whether it is school-going children or or people in different age groups who are learning, has its own limitations. The face-to-face contact with the teacher is not there. Your contact with your peers is not there. So it comes with certain amount of baggage, which is inevitable. But if you stay clear of that, learning can always be fun. Forget the modalities through which the learning is communicated, which is unavoidable these days. But whatever that you are learning, get involved in that and start enjoying the process of learning, which you can really freshen up your mind. So focus on learning, not on the medium.
Okay, thank you. There's another question. Are there any provisions to help students with the clinical anxiety and depression? I have particularly exam-related clinical anxiety and get panic attacks a lot of times while the test is going on, and this is affecting my performance. My undergraduate college used to give me extra time during exams and sometimes for submission as well. Do we have anything like this at IISc? That's a question. My PA is also my department HOD, and I have shared all my prescriptions and medical updates with him, if that may be required.
Yeah, this person is experiencing performance anxiety. And moment he knows that it has been there for a long time in his life, he must learn methods of handling it without feeling that the world has to accommodate to his performance anxiety. That cannot really happen in all kind of life situations, that others accommodate to issues that you face within yourself. To expect that you have to be given extra time because you have performance anxiety or certain kind of attitudinal changes has to happen from your supervisor is to feel that others play a major role in accommodating my performance anxiety and feel disempowered to handle your issues. Performance anxiety can be very effectively handled by counseling, very effectively handled by behavioral measures. So the person has to empower himself to handle it rather than feeling that others and the world outside has to accommodate his needs.
Okay, thank you. The next question is something more, with the contemporary issues. I was seeking counseling from a psychiatrist earlier this year for depression before the pandemic began. It was an in-person session and I was able to convey my problems clearly and seek therapy. Now, due to this pandemic, the psychiatrist schedules virtual sessions through a Zoom call. I find it hard to talk to a psychiatrist during such video calls. There are frequent network disruptions and bandwidth issues. Using a video call such as Zoom has privacy issues too, as there have been several security breaches in the past. Most importantly, I miss the human connection with the psychiatrist. I find it hard to stare at a computer camera and talk to a psychiatrist about my feelings and thoughts. I find phone calls / chat futile as the non-verbal aspect of communication is not conveyed accurately. I would like to talk to a psychiatrist in person and seek help to my mental issues like before. How should I go about doing that during this pandemic?
I have a disclosure in the sense, is discomfort about seeing a psychiatrist through this media? As a psychiatrist, I share the discomfort to a large extent of talking to my clients through this media. There is the human touch is lost, the face-to-face communication is lost, but these have occurred as a function of the changes that are imposed on us. These are not the excellent choices, optimal choices that we have made. We have made these kind of choices so that our helping behavior is not constrained by the limitations imposed from outside. So there are going to be limitations in through video consultation, which is inescapable. And if you experience, if you want to experience face-to-face,
Deepika Gupta, can you please mute your microphone? Yeah, thank you.
so if you're looking forward to a face-to-face contact, let us hope and pray that the hold of COVID weans off, and there is a psychiatrist who is willing to see you face-to-face. Kindly acknowledge that these are constraints that affect the psychiatrist as well as the clients equally. No psychiatrist is absolutely comfortable seeing a client face-to-face consultation. So operate within the limits and make the best use of what is available.
We have two more questions. What is the difference between a psychologist and a psychiatrist? How do I know whom to contact? How do you convince an individual to seek help from a mental health professional?
Yeah, this is a question. And having married psychologists, every time we meet somebody, we are faced with the same question, right? Essentially, psychiatrists have a medical background and psychologists have background in masters in and in clinical psychology, and they have undergone specialized training in clinical psychology. So basically, psychologists in India cannot prescribe medication. Psychiatrists can address in the distress in many ways, in addition to prescribing medication. As I mentioned earlier, often in depression, there is a close relationship with various kinds of medical issues. So psychiatrist is able to delineate whether there are any other medical issues associated with depression, identify and treat them, also prescribe medication when it is necessary. And most importantly, it is not that psychiatrists do not do therapy. There are a lot of psychiatrists who spend a lot of time addressing the needs of clients as well as counselors or other psychologists.
Okay, thank you, Dr. The last question: when should a person realize that he needs help expert's help. I am asking this because I am getting flashbacks of something, but I think I will be able to handle it. But I could not sleep properly for few days. So, what should be the alarm that we need? So, what is the alarm that rings that says, "Oh, you need psychiatrist help"?
Yeah. Firstly, about flashbacks. Flashbacks often indicate certain kinds of unpleasant memories, certain kinds of traumatic events. Flashbacks are always indications of some unpleasant association with these two. Firstly, we must recognize that. Secondly, if these flashbacks are disrupting your sleep and you feel that it is lasting only for a short period of time, your sleep cycle is not to disturb beyond few days, no need to take help for depression per se. But it will be important, as I indicated earlier, to meet a counselor to unravel the background of this flashbacks. If you unravel the background of these flashbacks, if you are able to work through those kinds of uh, traumatic events, memories, to a large extent, that itself will help you to address many of the emotional, psychological issues that you're facing in your life, both personally as well as professionally.
Okay, thank you, Professor Raghura. It was a wonderful session and it was quite very informative. Personally, I also enjoyed this lecture very much. Before I thank you, let me ask Dr. Bide to make some remarks before I close.
I thought that I would also ask you some questions. Feel free, sir. No?
I just want to.
Yeah.
Dr. Raghuram has revealed the secret that he's married to a psychologist. I was about to say that Dr. Raghuram only consults a psychologist, and Mrs. Raghuram only consults a psychiatrist. That's the difference between a psychologist and a psychiatrist. But I think it was wonderful that Thank you, Raghu, for accepting our invitation and being here, and also, as usual, for your very lucid presentation and your brilliant, absolutely brilliant slides that captivate everything that you have to say in your slide. I think that was a marvelous expose for our students, also how to make slides and make them catchy and pithy and relevant. I think you did a good job of your presentation, of course, and handling the very varied canvas that you had in terms of the questions that were asked. We look forward to having you again sometime.
Thank you so much for giving me an opportunity. It was really interesting to engage with the questions, and I hope that Wellness Clinic takes this initiative forward to the benefit of all the students and staff of the Institute. Thank you so much. Thank you, Ajit. Thank you, Professor.
Thank you, Professor Raghura. On behalf of Indian Institute of Science, we would like to thank you profoundly for this wonderful session. And the question and answer sessions were very lively. And this video will be available in our website of the Wellness Center for the people who can see this event again and again and again. So, and also the people who have not attended today, have the opportunity to visit the website and see the video. And Dr. Bide was raising his hand for making a remark.
I think last time we decided that we haven't implemented it yet. All our presenters are requested to have one slide with their email address, if you will encourage people to keep in touch with you on the mail. Professor Raghuram, can you share your email address?
Sure, definitely.
Can you just say it out so some people will take it down?
profraghuram@gmail.com. PROFRAGURAM without H @gmail.com.
Thanks.
And can you also send me a copy of the recorded video?
Sure, definitely. I'll share with you. Yeah. Thank you. Yeah, thank you. So I thank all the participants for attending this lecture with enthusiasm. So, and also all the students and the faculty and the staff who have sent the questions, and to make this session a very lively one. And I'm very sure that it was a useful session for everybody who attended this session. Thank you, Professor Raghuram. Thank you, Dr. Bide, for arranging this. Thank you very much.
Bye-bye.